Stuck with my first Malyugin. There are many firsts in every surgeon's career. Here I am sharing my first experience with a Malyugin ring. A 80-year male patient with not very hard cataract was posted for cataract surgery in right eye with mid-dilated pupil and history of tamsulosin intake and with shallow anterior chamber. Billowing of pupil was noticed with injection of adrenaline. So I knew this iris is not going to behave well. I stained the anterior capsule before injecting OVD. As the pupil did not dilate with OVD, I decided to go in with a Malyugin ring. I could manage to get 2 out of 4 scrolls engaged while introducing the Malyugin ring. And engaged the 3rd scroll with the Sinski hook. Following which I proceeded with the last one. I felt so relieved after the placement of the Malyugin ring without much of a hassle. But wait, what do I see here? And to my disappointment, I see a large anterior capsular tear while centering the Malyugin ring. The posterior extent of the tear was not visible. At that point of time, I had a complete mental block, did not know what to do. The first thing I planned to do was to release the capsule, which was stuck between the scroll and iris, by disengaging the lagging scroll of the ring, putting in OVD between the capsule and the iris and reinserting it, keeping the capsule free. Once that was done, I could visualize the anterior extent of the tear clearly. I completed the rhexis, taking care of the free edge, so as not to let the tear extend to the periphery. I tried to manage the capsular tear part with the microrhexis forceps and then started with the hemirhexis on the left side with a cystitome. As the rhexis was still not complete on the other side, I used a pair of micro scissors and then completed it with the microrhexis forceps. After that, the usual steps of gentle hydrodissection and delineation, a gentle phacoemulsification, taking care not to cause much of AC fluctuation, and then cortical cleanup with the help of Simcoe cannula for safety reasons. After that, a single piece acrylic IOL was injected into the bag, and Malyugin ring was removed and case was closed after viscoaspiration. At the end of 4 weeks, the patient had good post-operative vision. But I had learnt my lesson before doing my next Malyugin ring. I could manage to get 3 scrolls engaged while introduction, and then injected OVD between the iris and the capsule before going for the last scroll with the help of Sinskey hook. So at the end of the day, I learnt my lesson and learned to use a Malyugin ring properly. I was happy that I was able to handle the case properly and the patient had good vision, which is our main goal. Thank you.